Hey everyone, Dr. Kerry Yerkew here. Thanks for joining me today to talk about knee pain and what causes knee pain. We want to prevent people from having to have their knees wear out, to have a knee replacement or go for surgery. And the reason why knees wear out is there are injuries or imbalances to the knee. So the knee is a weight-bearing joint, and it's located between the hip and the ankle. So the hip alignment, the knee alignment, and the foot, the way the foot works, your gait pattern, the way you walk, all very important to the stresses that are put on the knee. Now, stress on the inside, this is the right knee facing us. So if there's too much stress on the inside of the knee, the medial part of the knee, it's going to cause some compression and damage to the inside. If there's too much stress on the outside or the lateral part of the knee, it's going to wear out the outside, kind of like a car that's out of alignment. You know, if your wheel keeps pulling to one side, your tires are going to wear out faster on one side than the other. There's also ligaments like cruciate ligaments. They form across the anterior cruciate, posterior cruciate. There's these lateral, collateral, and medial collateral ligaments. And then there's the cartilage in between the bones to cushion the bones, and some fluid in there that's held together in a capsule. So there's some synovial fluid in there that circulates in the joint. You've got some major tendons coming across the quadricep tendon, one of the biggest ones, from the thigh, the quad muscle, through the kneecap and into the tibial tuberosity right here. This thick tendon goes right through the kneecap. So if the muscles have an imbalance, if they're pulling the kneecap to one side, or there's a misalignment of the knee, the kneecap can start to rub on the inside or outside part of the groove for the kneecap, and this can cause friction. We call that patellofemoral syndrome when that happens. Also, we can have inflammation of the bursa. Now, the bursa aren't shown in this diagram, but bursa are like sacs of fluid that prevent friction between the muscles, the tendons, and the bone. And there's several of them around the knee. If those bursa start to get friction and they start to swell up because it's rubbing, then that can cause inflammation and that can cause a bursitis. That's what that's called. Now, if the joint starts to get inflamed and over time starts wearing out, that's called arthritis. And we want to prevent arthritis from developing in the knee. Now, I'm going to show you the webinar I'm hosting later this month. And if you want to come to this webinar, it's going to be on January the 29th. And this is at from 6:30 to 7 p.m. Pacific time. You can get a ticket by clicking on the link in the bio or the show notes below. When you go to get a ticket for this event, there's some free tickets that are available. There's also some paid upgrades like the VIP access, which allows you to ask some questions after the webinar is done about your specific condition. If you need extra help, we are going to have a mastermind group for 4 consecutive weeks after the webinar where you can participate and learn more about different stretches and exercises you can do, nutrition for your knee, the proper adjustments and alignment for the knee, exercises you can do, all very important to heal the knee properly. And then we're going to have some one-on-one coaching as well. So if you want a consultation, you can join me for one of those consults. All you have to do is click on the link and you'll be able to get a ticket for that event. So I want to thank you very much for joining me today. If you have any questions, you can certainly ask them here in the chat, but also attend the webinar, and then you can ask those questions in the chat during or after the webinar.